Welcome back. I'm Connie Center, Director of Construction at Torrance Memorial, and this is our first construction video since we've had a naming of the new main tower. So welcome to Lundquist Tower. And today I'm here with Shanna Hall, who is in charge of all of our inpatient units. In addition to showing you our beautiful nurse station, today we want to take you into the patient room to talk about what matters most to you, which is patient safety, patient comfort, and visitor comfort. So here we are in a patient room, and just knowing that nothing is left up to chance, we've had some very intentional design. One of them is this patient door and this leaf. Maybe you could tell us a little bit about this.
Absolutely. When the nurses are going in and out of the rooms, they can leave the leaf shut and use the door as intended. Mm-hmm. However, when they're coming in with a patient's bed and bringing other large pieces of equipment, this opens up and it is very easy to use. And that way the patients aren't getting bumped around, doors and equipment are not getting bumped around, making it easy for everybody.
Nice, nice. Well, let's take a look at what other features we have here in the patient room. So Shanna, talk to us about the patient light.
The patients have the opportunity to have control when they're in a situation where they have no control. So this is going to really help them feel part of the care team. They have the ability to control their reading light, the ambient light, as well as controlling their TV from their bedside, which is going to be a great feature for them.
Nice.
We know it's going to satisfy them.
So we're in a room that has a patient lift, and maybe you can tell us a little bit about that.
Absolutely. This is very exciting because the lifts are adding a real element of convenience for the staff so that they can have the ease of providing safe patient handling. So the lifts in the ceiling, as you can see, the equipment, very extensive. This particular room is equipped for patients of 1,000 pounds.
Okay.
However, the majority of the lifts are for 550 pounds.
Okay, that makes sense. You know, you talked about the element of control for the patient.
Right.
We've kind of adopted the same thing for the family or visitor space. And one of those is the light switches here. One controls the light sconce, and we also have a down light that's not visible because it's the daytime.
Sure.
But family visitors have control over these switches.
Wonderful.
And then over here behind me, we have control of the shades, window shades. This particular room has both a solar shade as well as a blackout shade in this particular room. And then the third element is that we have a designated outlet, believe it or not, right here. That's right. Where they can charge their devices without having to worry about plugging or unplugging something. So, you know, it'll be nice. We'll have a piece of furniture in here that will fold out into a sleeper.
Oh, wow.
And then we will have a lounge chair that has a tablet arm on it, kind of supporting also that philosophy that people are hanging out, they might have their laptop with them, and they can be comfortable as well as the patient. Well, what a better way to end this segment, Shanna, than to take folks into the toilet.
Absolutely.
And why would the patient toilet come into play here?
One of the first features is we have a private room with a private bathroom.
Right.
And there's a few features with the patient bathroom that I think are really special to show.
Right, and one of them is the hardware itself on the outside of the door. And the fact that we have emergency keys on all of our patient toilets today, but we have this caregiver override, which is really neat, in that the patient can actually go into the restroom and lock the door for their own privacy. But if there is a nurse call that goes off and a caregiver has to get to the patient right away, they can simply override and get in to assist the patient.
Great safety feature and convenience for the staff. They're not looking for a key.
Right. Well, let's go inside the toilet and just take a look-see.
Sure. Well, I noticed, Connie, when I look inside that it is very modern and clean, and I really like that there's two call lights, one in the patient shower area and one beside the toilet.
Yeah, that's nice. And also the fact that the toilet is floor mounted as opposed to wall mounted, which can be an issue sometimes in a setting where we've got so much use.
And again, the side rails for the patients to be able to hold on for safety both in the shower and beside the toilet.
Right.
Great feature.
Well, thanks for joining us today on our excursion of the patient room in the Lundquist Tower. And we invite you to stay tuned for more updates.